Has something lately left you wondering to yourself, wait, am I a sex addict? Maybe you're noticing that you're engaging in a lot of time watching porn or in other sexual activities. Maybe a partner's brought it to your attention. Maybe you're finding yourself masturbating to some odd fantasies. Or maybe you're dating someone that seems to always want to have sex. Or a partner's cheated multiple times and you're starting to wonder if they're a sex addict. Well, my name's Mishiko. I'm a psychotherapist at My Therapy NYC. In today's blog, we're going to explore the topic of sex addiction. I'll go over what professionals in the field of mental health have to say about it and hopefully give you some information that'll give you some clarification or direction. So the term sex addiction also goes by other terms, mostly compulsive sexual behavior, hypersexuality, and sexual impulsivity. For this blog, I'll stick to the term sex addiction. So first of all, sex addiction as a standalone diagnosis is not recognized by the DSM-5, which is the manual created by the American Psychological Association with the guidelines that mental health clinicians must follow in order to give a formal diagnosis in the United States. Okay, so now you're thinking, wait, so I can't be addicted to sex? Well, that's not necessarily true either. It is recognized by the World Health Organization under compulsive sexual behavior disorder. And clinicians and researchers in the United States have varying opinions. The reason it's not in the DSM-5 as of now is because there's still ongoing research. One issue is that society, as it changes, patterns in sex also change, and so it's hard to say what's not normal when norms in the population are always changing. For example, the invention of the internet has made the availability of pornography more accessible, and gradual changes in the amount of sex shaming towards women, women's empowerment movements, these types of things cause shifts in society. And then there becomes a new standard of normal. There really is such a wide scope of sexual interests and levels of desire that make it difficult to really say what is considered normal. Many sex-positive therapists and sexologists do not like the idea of pathologizing sex as if sex itself is the focus of the problem. What we're really looking at is addiction. And addiction has to do with how reward affects the brain and one's ability to refrain from engaging in certain behaviors or using certain substances. This is the latest definition from the American Society of Addiction Medicine that I really like. So people can become addicted to almost anything: shopping, exercise, plastic surgery, cleaning, eating dryer sheets. And so yes, this includes sexual activities. It's also worth noting that since sexual orgasm releases dopamine, a very pleasurable and rewarding hormone, it makes sense that sex could be more susceptible to becoming an addiction than, say, other types of behaviors like eating dryer sheets. There are professionals in mental health really dedicated to treating all sorts of addictions, including addictions related to sex. When professionals are assessing whether someone might have an addiction that is centered around sexual issues, here are some things that they will likely be asking about. Loss of control. Are you engaging in thoughts or activities related to sex more often than you're intending? Compulsivity. How long has this been happening, and has this been a problem at other times? Is there a pattern? Efforts to stop. Have you tried to cut back or stop the thoughts or involvement in activities related to sex but been unsuccessful? Preoccupation. Are you constantly fantasizing about sexually related activity or having other thoughts occupying your mind because of the sexual activity? Time loss. Have you lost or spent a significant amount of time due to engaging in, preparing for, or recovering from the sexual activities? Other losses. Have there been a loss in other important areas of your life due to sexual thoughts or behaviors? Inability to fulfill other obligations. Are the sexual thoughts or behaviors negatively affecting your family life, work life, school, social life, and friendships? Escalation. Has there been an increase in the amount of time or intensity needed to feel the same reward or enjoyment from the sexual activity? Inability to stop despite negative consequences. Have you continued the preoccupation in sexual thoughts or the behaviors even though there have been negative consequences? Financial consequences, legal, negatively affecting important relationships, physical consequences, or work or school related consequences. And withdrawal. Does stopping the behavior cause significant distress? These are some of the components that will help a professional understand your concerns and issues better. We are looking at multiple issues from the above categories and the degree to which they affect your life. So what is not sex addiction? So the following things in and of themselves do not equal sex addiction. Illegal activity, things like having sex in public, prostitution, etc. Involvement in these activities does not necessarily mean one is dealing with an addiction. Sexual offending. Sexual offending, although problematic, does not mean one is dealing with an addiction. Paraphilias. A paraphilia is when someone is sexually aroused by something outside of things considered to be within the conventional sexual norms. So just because you find out your partner's been looking at porn involving people handcuffed in leather chaps screaming, "Please, sir, may I have another?" does not mean that they have a sex addiction. High sex drive. Remember, there's a whole system set up in our bodies that tell us not just to want sex, but to need sex in order to procreate. Our survival as a species depends on that system, and that system shows up differently from person to person, and that is totally fine. Other things that are not addiction: masturbation to odd fantasies, watching porn for hours, someone with multiple sex partners, someone who's cheated on a partner and said they could not help it. Although these things could indicate sex addiction, more criteria would need to be present. If one is concerned that they might be dealing with an addiction involving sex, there could actually be another diagnosis that can better explain the hypersexual behavior, such as a personality disorder, namely narcissistic personality disorder or antisocial personality disorder, bipolar disorder, for instance, if someone is having a manic episode, impulse control disorder, PTSD, substance-induced disorder, dementia or another cognitive disorder, and adjustment disorder. An example of adjustment disorder would be someone who becomes hypersexual after going through a big divorce or another sudden traumatic experience, but does not necessarily have a history of patterns of hypersexual behavior. So, help for sex addiction. If you're concerned that you might be dealing with an addiction related to sexually obsessive thoughts or behaviors, the following can be helpful. Individual therapy with a component of trauma treatment. Group therapy. There are some 12-step programs. Couples therapy. Having support from a partner during this process can be very healing. So I hope you found this blog informative and helpful. For more information, please visit our website at mytherapynyc.com.